Going in depth tonight after a new study from MUSC suggests that South Carolina could be around a 65% level of immunity from COVID-19. The study was referenced by DHEC doctors today during a briefing, and they said that even though that number signifies progress, there's still a lot of work to be done in the Palmetto State. So we look deeper into the data to unpack what the numbers mean and also to really press doctors on the question of how close to herd immunity could we be.
Fox Carolina's Matt Kaufax joining us live outside DHEC offices in Greenville County with that story.
Yeah, guys, well, doctors say that the reality of the herd immunity situation is a little bit more complex than just putting a number on it. That's because of the amount of people that have immunity from the vaccine versus those that get it from contracting the virus and are still not vaccinated. Parents I spoke to, though, say they just want to know when all of this translates into more freedom of choice.
Dr. Jane Kelly says MUSC's new study is something that needs to be weighed carefully.
Probably the real level of immunity in South Carolina lies in between MUSC's estimate and our numbers with vaccine.
DHEC says as a state, South Carolina has around 31% vaccinations.
Natural immunity, we suspect, does not last as long as vaccine immunity.
MUSC numbers show Greenville and Spartanburg with higher than 65% total immunity, while more rural areas are a little bit behind.
The case counts of people getting infected who were not vaccinated, those are high.
This all comes as Governor Henry McMaster made waves for saying he believes it's time to do away with mask mandates for children in schools this week. It's something parents like Jackie Zanino say they agree with.
Our belief is that it needs to be the parents' decision. It's our right as parents, and we should have the choice, not the school.
Jackie, a member of a local community group formed after the governor's remarks, says she's worried.
Something as simple as not being able to see a smile on their friends' faces, that does something to them mentally.
She says they're not trying to convince anyone who doesn't share their beliefs, just change the policies.
You want to mask your children, wonderful, fine, perfect, do it, go for it. But it needs to be our choice.
I would also encourage, local communities, local jurisdictions to maintain their mask mandates.
So obviously we've got some competing perspectives. There were some other parents who reached out to me that shared Jackie's perspective today. Meanwhile, though, Dr. Kelly says that herd immunity isn't just a number. It's also dependent on behavior. And she says we really can't hang our hat on that 65%, say job well done, let's keep it going, unless we continue to execute in practice. Now, we also learned from Dr. Kelly and from other doctors that I spoke to on the phone today that they believe we're still a long ways off from total herd immunity, which if you look at the statistics, the medical data, it's around 80 to 85%, they say, is what you need. And they say the closer we get to that, the more steps we make, the more we'll get towards that freedom that parents like Jackie want. In Greenville tonight, Matt Kaufax, Fox Carolina, the 10 o'clock news.